The female around 8 months is prepared for spaying. So we have sedated it with xylazine, and then we have induced anesthesia using ketamine and diazepam. So right now we are just going for incision, that is just below the umbilicus, midline incision.
edit करत
We have taken the incision and now we will expose linea alba. So we have given a nick incision over a linea alba to enter into abdomen. Now we have grabbed the peritoneum and will give an incision on the peritoneum just to enter into the abdomen. The uterus, we will grab the uterine horn and move towards ovary. With a small pressure on the ovary, we will just bring it down. Chassis, we have applied curved forces and straight forces, and now we will cut it, the part of uterine horn, and will use catgut to ligate the stump of ovary. It has to be done very carefully because ovary is having rich supply of blood. So it has to be ligated very properly. And after that we'll just grab it just to check bleeding. So bleeding is not there, so we'll grab another horn to reach the another ovary and continue the same procedure. Continuing the same procedure to remove the another ovary.
This is the ovary.
For putting back that into an abdomen, we are checking for any bleeding. So there is no bleeding, so we can put back the stump into the abdomen. These are the uterine horns of a bitch, and they are very less developed. So now we will just ligate the distal part of horns. Now we will ligate the distal part and check whether there is bleeding or not. So we have grabbed it nicely, so there are very little chances of bleeding. The post-surgical complications can arise if there is a bleeding. So we are taking all the chances that the arteries and blood vessels are ligated properly. If there is no bleeding, so we can let it go back into the abdomen. After this, we are closing the peritoneum and abdominal muscles. We are suturing the abdominal muscles by using simple interrupted sutures. The incision is very small, so it gets closed in 2 simple interrupted sutures. So the abdominal cavity is completely closed. Now we will go for another type of sutures, where we will close the subcutaneous muscles and then go for intracuticle sutures. So now we are going for subcutaneous muscle suturing. That will be done in continuous pattern. So by this way we have sutured subcutaneous muscles also. Now we will go for intracuticle. and the close care has to be taken that both the ends of skin should be brought very close to facilitate wound healing. Taken that the first suture that should be brought very close, because that is very necessary for wound healing. See how we bring both ends of the skin close, and that is very essential for healing of wound. And another benefit is the dog can't see the sutures and suture materials, so it can't break those sutures. So now we will apply the final knot, and there is special technique. By this the knot has to be buried inside so that dog can't cut it with its teeth. See, we'll just grab the suture and have a throw from behind the knot, and it has to be taken out from another part of skin, and that's it. So this is how spaying surgery is done.